Hi, is it Ginny?
Yeah.
My name is Dr. Umar. I'm one of the FY2 doctors. How are you? You okay?
Yeah, I'm doing fine.
Okay, so I believe you missed your BLS training.
Yeah, I missed
What happened? Is everything okay?
I had to take an emergency leave for
Okay, okay. Is everything okay now?
Yeah,
You're back?
fine.
Hopefully it's nothing too serious.
Yeah, that's fine.
Okay, great. I believe we need to discuss BLS training today.
Yes, yes.
Okay. How's everything else going? How's FY1?
Yeah, it's going good, it's fine.
Yeah, are you enjoying it? Is it really stressful?
It's fine, I'm enjoying it.
Okay. You're not having any problems either at work or at home or anything?
No.
Okay, that's great. If you do, you're welcome to talk to me at any point or anyone else in the team as well.
Okay, thank you.
All right. So BLS, can you remember anything about it?
Yeah, so it is done when someone collapses and you have to basically that. If someone collapses, you do some measures to bring them back to life.
Okay, yeah, that's right, yeah, good. Is there anything specific that worries you about it that you want me to focus on? Or is it just the whole thing?
It's the whole thing.
Okay, all right. How do you want me to do it? How should we do? Do you want me to show you and then you have a go, or do you want to do it another way?
Yeah, you can show me once
Okay.
and then I will.
All right. Okay. Brilliant. Okay, that's fine. BLS obviously is some emergency life-saving measures that we give to anyone who has collapsed, stopped breathing, or obviously had a cardiac arrest. So it can be in a hospital environment, or it can be outside hospital. It could be on the street, in someone's house, whatever. Okay. So there are a few things. First of all, you need to check if it's safe to approach, both for you and the patient, because there might be, maybe they had an electric shock, maybe they slipped, hit their head, there might be some water on the floor or something. So check it's safe to approach first. So what I'll do is I'll just go through the steps. Yeah. Do it as I would do it, in the real world, and then you can ask me any questions, and then you can have a go as well. Yeah, okay. Sound good?
Yeah.
Okay. So I'm going to check it's safe to approach. There's no danger. Hello, sir. Can you hear me? So checking response. Hello. No response. Help. Somebody help. So I need to get some help, whether I'm in hospital or outside. Okay. So first thing is I'm going to check the airway. I'm going to have a look inside. Looks fine. There's no obstructions. And there's nothing, the tongue hasn't fallen back. Okay, next thing I'm going to do is head till chin lift and check if the person is breathing. Look, listen and feel for 10 seconds. Okay, 7, 8, 9, 10. Okay, patient's not breathing, so I'm going to proceed to chest compressions. Okay, don't need to check the pulse. I'll discuss that afterwards. So, going to find the xiphisternum. All right, going to put my dominant hand down, keep my legs, keep my arms straight. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. And I would carry on doing that to 30 at a rate of 100 to 120 beats per minute. I need to depress the chest enough by 5 to 6 centimeters, ideally, if I can. So deliver 30 chest compressions. Then give 2 breaths. Now, if you're in hospital, you use a bag valve mask. Do you know how to use one of them?
Yeah, I know.
Yeah. If you're outside of hospital, you have a choice. Either you can, if you have a pocket mask, use that. If not, you have a choice of either giving the breaths or don't give them, because what's more important is the chest compressions. Yeah, obviously you need to keep yourself safe as well in terms of infection risk, etc. So it's up to you. Okay. Most people would probably prefer not to, particularly if it's a stranger. But I've just cleaned that, so I'm gonna give the breaths. So pinch the nose, okay. Just checking to make sure the chest rises. That's 1. That's 2. 2 breaths. Then I'm going to come back over here, look at the xiphisternum again, and I'm going to carry on with my chest compressions at a rate of 100 to 120 beats per minute. Okay? Now I'm going to stop if one of 3 things happens. Either the patient recovers, shows signs of recovery, in which case I'll put them into the recovery position, or help arrives, or I feel so exhausted that I think I might, injure myself or collapse. Okay, but hopefully you'll get help by that time.
Yeah.
Does that seem clear?
Yeah.
Anything you want to ask about any of them steps?
No, I think it's fine.
You sure?
Yeah.
Okay. Do you want to have a go?
Yeah.
Okay.
Okay.
Yeah, well, let's swap. So this is Mr. Johnson. You've come into, you just walked down the corridor of the hospital and you see him on the floor. Okay, so off you go.
So I'll come in. First, I'll check for the same safety. Okay. Then I'll try calling him. Mr. Johnson. Since he's not waking up, I'll check for his airway. Then I'll chin lift, and then I'll check for breathing. For 10 seconds, I will check whether there is any breathing or I can feel the breath. Okay.
2 minutes
then,
remaining.
I'll call for help. I'll shout for help. Help someone come. Then I'll come in and I'll start for chest. I'll start chest compressions near ziphy sternum. I'll have my dominant hand below.
Yeah.
Then I'll start with 100 to 120 compressions. 1, 2, 3, 4,
That's
5.
yeah.
Keep my
How many are you going to do?
30.
Okay.
We do with 30. Then if I'm in hospital, I might have access to an ango bag.
Yeah.
Then I will give 2 rescue breaths.
Okay.
Then I will go back again to give 30 compressions.
Yeah.
Okay.
Okay. Perfect.
Yeah.
When will you stop?
I'll stop either if patient has a return or if I am getting tired or if there's no.
Or you get some help.
Yeah, if I get some help. Yeah.
So they can take over or you
Yeah.
can swap around. Yeah.
Yeah.
Just a couple of things. One, when you check response, make sure you fix the head.
Yeah.
You put your hand on the shoulder and you can say, "Hello, Mr. Johnson, can you hear me?" You've got to shout loud. When you shout for help, you've got to shout loud as well.
Okay.
And the other thing is, when you do head to chin lift, obviously you have to do it like that. If there's any risk of C-spine injury, you don't do head to chin lift, then you do a jaw thrust. Okay, do you know how to do a jaw thrust?
Yeah.
Yeah, you pull the jaw forward without moving the neck. This one doesn't really do it very well. And the final thing is, when you look, listen and feel for breath, you need to get down. Feel on your cheek, listen with your ear, and look down the body
Okay.
for 10 seconds.
Okay.
You don't need to check the pulse because the guidelines were changed quite a few years ago. So pulse check isn't necessary anymore. Because actually, even if they have a pulse, a weak one, if they've stopped breathing,
You have to get,
sooner or later it's going to stop anyway. You're going to have a cardiac arrest, so it's more important.
Move on to the next station.
Thank you very much.